Well, hello, everyone. And thank you for joining us this afternoon in our panel for the discussion of the invisible and undercounted, the exclusion of U.S. territories from national datasets. And also we are going to be discussing the subsequent effect of being absent from those national data sets. My name is Marina Diaz. I have the honor and privilege to be facilitating this discussion today. I serve two territories, Puerto Rico and the Virgin Islands. And I want publicly to use this opportunity to thank the father and mother of the subcommittee for the discussion of territorial issues, Darcy and Thomas. Hi, Dad. It is our goal today to provide you with unique perspectives on the exclusion of U.S. territories from national data sets, their subsequent equity impacts, data collection challenges, and potential solutions to provide greater representation of the U.S. territories in national data sets. Geographically isolated communities, which is the way that territories are being mentioned in the discussion of inequities, deserve our attention because their residents face unique challenges, from extreme poverty to historical inequalities. Raising awareness of the lack of representation, followed by increasing the collection and reporting of data specific to the U.S. territories, can advance health equity for all those who live and provide services for the people that live in the U.S. territories. Before jumping in, I wanted to briefly introduce our panelists, which are here, and highlight some of the different perspectives that we'll be bringing to the conversation today. Thomas Bane, Dr. Thomas Bane, a person that I have the honor of calling my friend, is the special assistant to the regional administrator of CMS Regional Office in New York. He also shares the CMS Rural Health Council for the Pacific and Caribbean territories. He will kick us off by providing contextual information on the representation of the U.S. territories in national data sets. Alex Wheatley, the Director of Island Support at the Association of State and Territorial Health Officials, will follow with the challenges, priorities, and next steps that come with data collection and visibility in the territories. Next, Jay Junley, a senior policy analyst at the Georgetown Center on Poverty and Inequity, will provide some strategies to advancing data equity for the territories. And last but not least, Dan Doyle, the Deputy Chief of the Decennial Census Management Division at the U.S. Census Bureau, will provide an overview of the island area censuses. We will then move for a question and answer at the last 15 minutes of our presentation. I am now going to hand it off to our first panelist, Dr. Thomas Bane.
Thank you, Marina. Can I write here? Okay. Well, thank you all for coming to be with us for this discussion this afternoon. I know there's been many great sessions, and we've all been in lots of conversations, but I want to start by thanking the conference organizers for recognizing that at a conference on health equity, we also need to raise awareness about issues in the territories in the Caribbean and the Pacific. So I'm just so glad that this conversation is happening and that we have these wonderful speakers here. But before I get into it, just, show your hands, I guess, who is either from the Caribbean or Pacific or works in issues related to the Caribbean and Pacific. Or is this, okay, we got a couple of folks. Great. So some of you, I guess, maybe in learning mode or in interest mode. So we appreciate you being here as well. I'm going to see if this clicker can work. So I'm just going to set some context for the conversation. There's a group within the Centers for Medicare and Medicaid Services that falls under the Rural Health Council focus on issues specifically in the Caribbean and the Pacific. And it's been great to have colleagues from the Medicaid side of the house, from the survey certification side of the house, as well as from our regional offices, including Marina, who manages our Puerto Rico office. And we also have a Pacific area representative based out of Honolulu who covers the Pacific territories as well. So it's been a really collaborative effort. And about a year or so ago, we started to dive a little bit deeper into the data and largely gaps associated with the territories. And we found some really great information that was written by the people on this panel. So we knew we had to come all together and share this information with all of you today. So let me share some of the things that we've been discussing just internally. So if you're newer to the conversation around the territories, there are 2 in the Caribbean and 3 in the Pacific. So in the Caribbean, we have Puerto Rico and U.S. Virgin Islands. And then in the Pacific, we have American Samoa, Guam, and CNMI. So the geography becomes really important to this conversation, as Marina mentioned. And part of our conversation around kind of undercounted and invisible is just the distance of these islands from places like Washington, D.C. So for instance, in Guam, it's already tomorrow, right? So it's time and distance that we kind of in the East Coast center kind of East Coast value. So I know, Alex, you can probably testify to this as well. You don't have calls with the Pacific territories at noontime, for instance, because it's not going to work out. And I think that that's really important for us just to celebrate also the reach and breadth of the territories and the cultural values and all the things that make them really wonderful places, at the same time challenging ourselves to make sure that they are not overlooked in national conversations. I think people also don't always realize that if you were to take all of the territories together, the populations are larger than some of our states, right? So people often just think, oh, there's not a lot of people out there. And there's not as many compared to all of the states necessarily, but they are also larger than one would think. So Marina started to tell us how we could think about this sitting inside the work at CMS. So we do have our strategic pillars, and we think that this falls clearly within the health equity pillar. We also have our framework for health equity, which you may be familiar with. And then we also have our geographic framework. So we're really kind of tying all of these together through a lens that focuses on the territories. And in fact, we do believe that if we can solve some of the challenges associated with the territories, these could be useful lessons for other geographically isolated parts across the country. So we're trying to keep everything in conversation. And this is one of the key takeaways from my part of the presentation I hope you'll walk away from. And it's largely learning from some of these great colleagues on the panel as well. But we have to start thinking about the upstream when we're talking about the data. So once you start having the territories be absent in one place, trickle down effect that's going to be absent in other places as well, even if we don't realize it. So I think one of the major takeaways for us, and you'll hear more from our colleagues on the panel, but not all of the territories collect the ACS, the American Community Survey, each year. And then we have all of these wonderful indices related to social justice, environmental justice, that's pulling from the ACS. So if the territories aren't in the original, then they won't be able to use these indices as well. And so you can just see what we're thinking about in terms of the ACS, only 1 out of 5 territories included, BRFIS 3 out of 5, CDC Vital Statistics 5 out of 5, which is great. But then all of these other things are pulling from them, and that absence kind of is echoed throughout. So that's, I think, the key takeaway I want to leave you with today is that absence upstream results in absence downstream. So this is some of our things that we're thinking about. Related to what I just said, a lot of these indices are focused on social determinants of health, which is such an important priority now. So again, we're having that absence in conversations for the territories if they don't have the data to be part of that conversation. And also, we want to also just recognize that Puerto Rico does sometimes get a lot of the attention because it is a larger island and a larger population. So there are things happening in Puerto Rico that are not happening in the other territories. And I think we have to pay attention to that as well. So we're going to need to continue to look at the data. We're going to need to continue to ask these questions, kind of raise the hood a little bit and look underneath to see where can we do better and where can we kind of chart a course together. The other thing is that it's just a little bit difficult to look at national data sets and immediately know if a territory is included or not. So we're also trying to think of ways that we can just educate the people that make the data sets to flag in certain ways that the territories are included or not, because that can just make it more clear to everyone. So we're also just thinking a call to action. We're looking forward to the conversation with all of you in a little while. We hope that you will continue to engage with us and the panelists. And I think that there's a lot more work to be done, but a lot of good work happening in the territories as well that we wanted to celebrate. So this will conclude my part of the presentation. And Alex, I will turn it over to you.
All right. Everyone can hear me okay?
Yeah.
Thank you so much, Thomas. And Thomas organized all of this. So huge kudos to you.
Thank you.
My name is Alex Wheatley. I'm the director on the Island Support Team at the Association of State and Territorial Health Officials. I'm going to talk to you a little bit about my entree into this work and then some of the data work that we've heard about from our islands over the last year or so. If anyone's not familiar with ASTO, vision, mission, fancy strategic plan. In short, we're a nonprofit based in Arlington, Virginia. We serve the chief health official of every state, territory, freely associated state, and Washington, D.C. So we support them with policy, peer connections, programmatic stuff, sort of whatever they need. And on the Island Support Team, I specifically work with the health officials from the 5 territories and the 3 freely associated states. So as we talk about islands, my definition for islands is perhaps a little bit broader than just territories. I know we had some new folks in the room, so I think this is maybe a helpful starting point. The green at the top is the 2 territories in the Atlantic. Then you have the 3 territories in the Pacific and 3 freely associated states. I work with all 8. I think a couple of highlights worth noting. None of these folks can vote for U.S. president, but all serve in the U.S. military. And actually, most of the islands have induction rates, higher per capita induction rates than most of the states. And given this is a CMS event, the Medicare eligibilities may be of interest. The territories do have Medicaid and Medicare. Medicaid is capped, so it functions more like a block grant than an entitlement program. If anyone wants to wonk out on territorial Medicaid programs, I'm here. Let's chat. And then the freely associated states do not have access to Medicaid. I think given it's a health equity conversation, I do want to share a little bit about how I came into this work and what ASTO's role is. I think the guiding principle of my team at ASTO is really looking at health equity, both building health equity capacity within island jurisdictions and looking at health equity considerations between states and islands. So we don't shy away from the fact that islands experience a colonial history and present, that there has been systemic underinvestment as a result of those sort of systematic influences. There are significant health disparities between islands in the states and between islands. You know one island, you know one island. And sometimes those health disparities are hard to see because of the issues that we'll talk about today. Islands aren't necessarily shown in data sets, in resources, in sort of the go-to things that most public health professionals look toward. Islands are sometimes invisible and out of sight, out of mind. So I think our team, what I'd like to say is that, support structures were often built with states in mind. And there's a need for some specialized support to make sure that those structures translate into an island context. And that's what my team tries to provide to the health officials we work with. In terms of health equity within the islands, on the bottom right here, you can see that's a Pacific health equity framework. The idea being that health equity has really become cool in the last couple of years. There's been all this funding, there have been all these conversations, but state-based conversations about health equity don't always match the island context. I talked about that colonial history. I think you look at populations that are majority minority, that have different migration patterns, different colonialism patterns. And I think we've really worked with the islands to help them find a definition for health equity that resonates locally and that they can build on and work into their local systems. So that's the space that my team works in. I'm based in Virginia. I took this photo of our island officials looking very cold on the steps of Capitol Hill. But that's a little bit about me. And I guess before I pivot to some of the work of the group, I think it's worth noting I am not an islander. I cannot speak for the islands. I can just amplify what I heard. And if anyone is interested in working more closely with the islands, consider me a resource. I would love to be a connector. But, take what I say with a grain of salt. At best, I can amplify. Okay. So what I want to talk about today specifically is ASTO runs a group called the Island Areas Work Group. It focuses on what we call little p policy, as opposed to work with Capitol Hill, which is more the legislative change, the big P policy. This is little p policy. It's the administrative and operational policy things that have a huge impact on health outcomes, but don't need an act of Congress to change. This group started up in 2021. We have, I think we're about 150 strong on the email list. That translates to about 50 at any given meeting. But we meet quarterly. It's run by a health official from CMMI and USVI, CEO Esther Muña and the Commissioner Tita Encarnacion. The group really organized itself in 2021 saying, hey, we have a need to make some connections to address some of these common operational challenges that we've seen. And we think there needs to be a space dedicated to island health equity conversations. That's how this group came to be. It's organized into 3 subgroups: health financing, workforce development, and data capacity. Each year, each subgroup creates a set of deliverables to share back with the broader group and guide the next year's work. I think there have been 2 groundbreaking reports, one of which I will talk about in depth, which is the rooting island areas in federal public health datasets. Okay. If the QR code is too small, I'm fairly certain if you Google ASTO Island Data Report, it will come up. But this is the report that the data capacity subgroup created in 2022. A couple of the high-level findings were the group identified 32 commonly used federal public health datasets that islands really wanted to understand more about. Of the 32 datasets, 18 included at least one island, so it's just over 50%. And only 2 included all 8 islands. Puerto Rico, Guam, and USVI were the best represented, while the 3 freely associated states, Palau, Marshall Islands, and the Federated States of Micronesia, are the least represented. And some of those data sets are sort of nationally representative samples or some methodology other than jurisdiction-level data. Of the 20 reports that had jurisdiction-level data, on average, they included 98% of states, but only 36% of islands. So there is a difference. Even where states aren't fully represented, they're still represented more than islands. The report in 2022, we didn't get into the why. We just wanted to understand where islands were present versus not. But the why can vary a lot. Are they not eligible for the grant that funds the work? Are they not included because the N is too small and the methodology doesn't work? Maybe they're not interested. Maybe it doesn't resonate locally. We didn't get into that in 2022, but that's where we've gone since then. So currently, the group has identified these 6 data sets that it wants to really understand more about. And the group, I should say, is made up of island health officials and their staff, as well as federal partners and regional partners. So collectively, they have said, we want to understand what the barriers are and see what we can do to address those. I'm going to dive into, the work is ongoing. We are hoping to put out an addendum to that 2022 report this fall. But in the meantime, I'll share one story of a recent conversation where we were trying to get to the bottom of island representation in the past. Sorry, it's like a little wonky control there. So as of 2022, when we did this research, there are 3 islands represented in RFIS. And I think folks are probably familiar with RFIS, but it's a really great source of data, especially for chronic disease, which is a top priority continually in the Pacific. The way that support for this participation in this data set works is that there's a NOFO that's released every 5 years. Islands can apply to, they get funding to support TA and sort of operating this survey. The NOFO just passed. The most recent one was due in April. We talked with the islands in a recent meeting and said, does BRFIS make sense locally? Do you use it? What are the issues? And what they said, BRFIS uses landlines. Most of the islands use pay permanent cell phone plans. So landlines really, it's not going to work methodologically. Also, in order to participate in BRFIS, you have to use a certified call center in the Pacific. The closest one is Hawaii, which is 7 hours by plane, many time zones different, culturally distinct, doesn't necessarily speak the local languages. And those sorts of methodological challenges left a lot of islands saying, we want the BRFIS style data available locally, but actual BRFIS doesn't make sense for us. And we said, okay, how would you get that data locally? Like, the goal is for you to have the data you need for local decision-making. What works? And we heard about an alternative system. The Pacific Island Health Officer Association, or PIHOA, runs something called an NCD hybrid survey, and it kind of combines BERFS questions, WHO STEPS survey, and NHANES. They do in-person measurements. They go door to door, go to schools. They have a youth and an adult. And they've sort of said that makes more sense and works locally. That's how we can get the data we need. And that's NCD hybrid survey is really widespread. Most jurisdictions in the Pacific have one within the last 2-3 years. So in the discussion about, hey, islands aren't represented in BERFS, that's a problem, we should fix it. The conversation first starts with, well, does it make sense locally? Do the islands want to be a part of it? If they don't want to be part of BERFS, the end goal is just to make sure they have the data they need to address their population health needs. And maybe the NCD hybrid survey is the answer for how to get there, in which case the question evolves to, how can we make sure that the data that exists is more visible to help with those upstream efforts that Thomas started us off with? So that's just one example. As I said, the work is ongoing. I'm here for questions, and I know GAO just did an exciting report, and I'm happy to talk about that if you like, but I will pass it on to Jae-Jun, and many thanks to my excellent colleagues who are not here.
Great. Hi. I tend to mumble and speak softly, so at any point, feel free to raise your hand. My name is Jae-Jun Lee. I am a senior policy analyst at the Georgetown Center on Poverty and Inequality. My work focuses primarily on the decennial census and federal statistical systems more broadly. So that's kind of the angle at which I'm coming at it. And we do a lot of work with civil rights organizations to advance data equity and justice, specifically looking at things like the differential undercount. And today what I'll be talking about will be based on some great work that we did 2 years ago with our colleagues over at Right to Democracy. I'm excited to get into it. And I'm going to start with a little story that for me symbolizes, I think for me personally felt like a moment of, this is a very symbolic of the exclusion of the U.S. territories in the federal statistical system. Wrong button. Great. Also, so I'm a census nerd, and like many census nerds, we all look forward to this thing that happens once a decade as the census concludes, or not concludes. The first data are released. There is a big press conference that happens where the Census Bureau announces the national totals. It's traditionally happens it's a bit of a routine. It happens before December 31st. There's a statutory requirement that they're delivered to the president on December 31st of a census year. Shortly thereafter, the Census Bureau hosts this sort of big event. And this tradition has been going on for decades. So, we have 1990, Bob Bryant, I think that's Ken Proto without the 2000, and then Bob Groves that we held the 2010 census, with, I think, undersecretaries or secretaries of commerce presenting as well. And it's a big affair because every decennial census fulfills a constitutional mandate. And that is, the census data are the statistical backbone of our nation's democracy. And it determines the allocations of seats that the U.S. House of Representatives gets allocated to each state based on populations. And there's also a lot of discussion about, you can see on the top right now, about, which states have gained population, which have lost seats in the House and things like that. So it's quite an affair. And this year it was a bit different, a bit delayed due to the pandemic, and it was virtual like many things were that year. This is the population total that came up, the 2020 U.S. population, 331 million. And it's usually the number that a lot of the press picks up on. 331 million people in the U.S. and kind of all these discussion about which are the fast growing states and which have lost. I think New York, for example, lost a seat in the House of Representatives by just 89 people. So there are things like that. Fun stories come out. But what I found interesting is that the actual U.S. population is 335 million. This is run because U.S. territories aren't included in what is called the resident population or the resident apportionment, for apportionment, which actually includes the representation there. So that's actually a little bit, I couldn't actually find a single news report that cited the 335 million. was just one Wikipedia article that kind of came up with it. And again, the total is kind of showing the US 50 states and DC versus the total population of the US territories. And that one, a good metaphor for me is there's a historian called whose name is Daniel Inouye, and he talks about how the US territories are often strategically cropped out of the family photograph. And that seems like an apt metaphor where you have some members left out of sort of the national picture. Photo so is, I guess, a happy family, but it's not the whole truth. And it affects our understanding of the nation and its history and its people. So there were just 3 points I'd like to make today. First is that the US statistical system is dangerously incomplete, as many of the presenters before me have already quite accurately talked about. And the second one is that the data disparity is just not only an issue of equity justice, but of racial equity justice. And then the last one here is that there are concrete steps that can be taken at the federal level to bridge the gap. Great. So I'm going to dwell on this slide again because it was well covered before, but again, our focus has really been on the decennial census, American Community Survey, what's called population estimates, the annually updated population estimates between each decennial census, and the current population survey, which altogether for me really formed the foundation of the nation's statistical system. You get a whole bunch of, as someone was mentioning, indicators that can come out of it as well. Things like current population survey, you get the supplemental poverty measure that comes out of that as well. These are really important data sets. But let me just say 2 things on this slide that kind of follow on to the story I was talking about. Is the first is even when territories are included in a data set, it's not whether they're included or not, it's also a question of how they're included. What's the timeline for their data releases? And with the decennial census, for example, the smaller territories, Puerto Rico excluded here, don't have quality evaluations of what we call post-enumeration survey and demographic analysis that helps us understand who's undercounted and overcounted, for example. That's pretty important. And then the second one I want to say that this is also a reflection of, I think, the territories and the underlying statistical infrastructure that really makes some of these surveys happen. And that also impacts things when we're doing testing for new things. So, for example, I think there was a session on it earlier today talking about the new race ethnicity standards. The testing for that included Puerto Rico, but it didn't include the rest of the territories. And when we think about things like sexual orientation and gender identity question testing in the ACS, well, I guess the smaller territories would still get the long form, but they weren't included. Puerto Rico wasn't included in the testing, or at least planned testing for the SOGI question either. So there's a lot of different ways in this inequality just pops up rather than just focusing on, I think, on data products and who's included or not. Great. So I'm going to go to the next point I want to make, and that the data disparity is an issue of racial equity. And this is from the 2020 census, demographic profiles that came out. And as you can see here, the vast majority of people in the territories, I would loosely say, would identify as people of color. Puerto Rico, overwhelmingly, you have people identifying as Hispanic in combination with sort of some other race and maybe white. In American Samoa, a vast majority of people identifying as native white islander. That's the same with Guam and Northern Mariana Islands, but that also includes a lot of people identifying as Asian as well. And in the US Virgin Islands, with a very large majority of people identifying as Black. Just a quick note here, this won't sum up to 100 because I'm using the alone and in combination statistics. And so I think the important points to make here is that data gaps that means that voices and experiences of millions of people of color in particular here, are made invisible. It hides and perpetuates cycles of marginalization. And addressing these data disparities are crucial for achieving racial equity. So that's kind of very much a lens that we see this issue through. And that by addressing this issue, when you're looking at it, we're trying to recognize and say that every community in the United States should be served by our national policies. And the impact that this has is it undermines the ability of policymakers and researchers to actually understand local challenges. And one of the things I've personally been trying to focus on is that our extreme weather events that are happening that impact that we kind of need very live, good quality data to understand the impacts of extreme weather events, the climate emergencies, and of course, social and economic inequalities that might be exacerbated by the climate emergency. I have an example here that I'm not entirely sure I've got too much time to go into, but it's about when the COVID-19 pandemic hit. Obviously, it had wide impacts all over the nation. including the U.S. territories, but there wasn't very good data. So there's one good example here about, 5 U.S. territories were excluded from CPS. There was a question added to CPS in May 2020, I believe, that was sort of studying the impacts of the COVID-19 pandemic on the labor force. Territories did not get that. And so they had lacking timely data to respond to pandemic impacts. There was something that folks trying to rely on with the GAO report that is authored by Italy on the Northern Mariana Islands, but just to highlight some of the issues there, they had to rely on less accurate annual employer surveys that took a huge hit as one term of self-response during those 2020, 2021. At the same time, just given the sort of the sparse timing of this data, it was really hard to disaggregate it from lingering impacts from the super typhoon Yutu. But it's sort of really hard to kind of understand what happened when. Great. So that's just the last thing I'm just going to end off on. I'm going to focus on two of these. We'll leave the two more, I think, technical ones to my colleague will go right after me. And so I think they delve into some of this. But yeah, so two things that we did in our 2022 report that we discussed was a GAO review that we wanted to support Chairman Raul Grijalva, who was, I think, that still is the chair of the House Natural Resources, and had written to GAO asking for a review of data collection. And Alex mentioned that came out, I think, last month, so we're very happy, read through that. It was really great to see. And one of the recommendations that kind of aligns with what we were thinking well at the time was revising and strengthening standards, policies, and norms. And one thing that we actually looked to was why Puerto Rico was treated more favorably, obviously a very large population. But one thing that we actually saw was in 1992, there was a presidential memorandum signed by George H.W. Bush directing agencies to treat Puerto Rico more like a state in the statistical system. So that's something that we've taken as sort of inspiration. And I'll come back to this one. And in discussions, we've been engaging the Data Disaggregation Subcommittee of the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. One of the things that was forwarded is expanding that executive memorandum or that presidential memorandum or executive order in this case here to say that all the U.S. territories should have comparable treatments to Puerto Rico in the standards and policies and norms of federal departments. Perhaps doesn't go far enough, but I think that's a very good step, at least saying to agencies, you should try and make it happen where you can. But I think a part of the issue here is funding as well. Right. And then I just wanted to highlight this bill that's currently in Congress that was introduced in this Congress and was first introduced in the previous Congress that sort of which go a long way in addressing the disparities in data collection in the U.S. territory. So there is sort of legislation there, and there are sort of executive action that could be taken. And I do want to acknowledge that there are very difficult technical operational challenges, and including this, especially the smaller U.S. territories in our statistical system. But I think it is the way we include remote Alaska, for example. We don't not include remote Alaska because we see it as a operational challenge, but it's an important part of democracy, and so I think that's something that should be prioritized. Let me just quickly end off on one last thing, is just to say that data is power, and by ensuring accurate and inclusive data collections, we empower communities, inform better policy decisions, and strengthen our democracy. And that I'll end. Thank you very much.
I did not pay him to say he's a census nerd, although set me up great.
I know, right?
September 11th, 2019, it was day one of a 364-day deployment to the Virgin Islands. As my plane descended down on the runway to St. Thomas, I was nervous, excited, fearful. Look out the window of my plane and I see 4 police cars with their lights on. Looked odd. Then they had their sirens and they were pulling our plane over, which was weird. The pilot gets on and says, "Everybody stay seated. We're being boarded by VIPD, Virgin Island Police Department." This was cool. The honeymooners were like, "Oh, yeah." And so 8 police officers and a dog board the plane, and they come back to row 21 where I happen to be sitting. and they ask me my name, and I tell them, and they say, grab your things, you're coming with us. And that was the start of, I think, a foreshadow of the pandemic. But the next 4 hours, I cleared up the fact that I was allowed to have 100 unused government PIV badges on my possession, something that was picked up on Puerto Rico when they stamped my bags, and then they flagged the FBI and the state's attorney to put my clean over and pull me off. So, it's good to be here today. My name's Dan Doyle. I'm Census manager for Decennial Census. I'd also like to recognize my colleague, Dominic Beamer, who is the assistant division chief over decennial enumeration, and island areas is under his large breadth of work. So I agree with everything my colleagues have said, and I want to talk a little bit about how the island area censuses relates to the Census Bureau, and hopefully give you a little more information. So this is our marching orders. Article 1, Section 2 of the United States Constitution mandates a population count of the people for the people every 10 years. So Title 13 is our of the U.S. Code, Section 191, gives us the authority to collect the data as well as the geographic scope, which is the 50 states plus the territories. And so island areas, as you have learned, means something different to every agency. So when I say island areas for census, we're talking specifically about the Virgin Islands, Guam, CNMI, and American Samoa. Puerto Rico is a larger population, and we have more of a physical footprint on island, and thus is not considered part of the island area territories that we consider. Census data is extremely important. It's used for apportionment, going back to 1790 for our first census. And then fast forward to present day, and we're gearing up for the 25th decennial census in 2030. So from that data, lots of funding, trillions of dollars, gets allocated from federal programs, as well as it's the backbone of the data for the next 10 years. And I'm speaking more high level, stateside, island areas now, and then we're going to dip down into island areas. So how is the data used for communities? Number one are funding all the allocations for big federal programs, SNAP, Medicare, Social Security. They use census data to model eligibility. It's used all over the place. You can turn on MTV and they'll reference Census Bureau data on, what we think is Southeast United States. So turn on the radio, TV, and you can hear our data everywhere. And businesses uses ours to make data-driven decisions so they can stay open. So let's talk a little bit about the island areas. Island areas is only collected once every 10 years. And so we talked about 1790, and the country was a lot simpler back then. And then as we roll through the 10 years, we started adding questions to our decennial census to the point where it got really long. And then in the 2000s, we broke off the American Community Survey, which is a sample survey of 250,000 households that just keeps rolling on. And then the island area censuses isn't a part of that. And we'll talk a little bit about that. So we use the long form for the island area censuses, and we'll talk about what that means. But it's a lot more data collection than just the 10 questions, 10 minutes that you'll hear stateside. So the island area censuses, for us, we partner with the local area governments, and we sign a contract with them, usually in the 6th year. They pick a liaison agency that we work with. The Census Bureau provides the funding, the methodology, the IT equipment, all of the materials, and we provide an on-site census advisor to be the eyes and ears of the Census Bureau and just to provide oversight for the entire operation. And what I have found is that the census advisors become more of an advocate for the islands than really being from the census. So, and something I continue to do is advocate for the islands since being back. The unnamed governments are in charge of the management of the data collection operations, so they will hire and manage the staff, all with the funds that the Census Bureau provides. And we established 5 offices. We have 2 offices in the Virgin Islands, 1 in St. Thomas, 1 in St. Croix, and then the 3 in the Pacific. So the methodology, we use in-person paper-based. So we start with the address listing, and one of the things that island areas has not had in the past is a master address file. So what Census Bureau does is right around 2016, we went out and using satellite imagery, we created housing units where we think there are housing units. And then we created these maps with work finders and sent them out. So staff would go out to the field and they would verify housing units of where they thought people lived or stayed. And then we collected that information, went back out, and then with a paper questionnaire, long form, asked every person in the household a long list of questions. It's a lot longer than 10 minutes, and we'll get into some of the questions. What I will say is that JJ mentioned this, there's no PES coverage study in the island areas. We do perform quality control throughout every step in the operation from listing, and that's doing a 10% check to supervisors checking to the census advisor going out into the field to ensure that the quality is up to par, to quality checks once the data is brought back into the office, to quality checks once it's shipped back to Census Bureau, the National Processing Center. So while we do not have a undercount, overcount coverage study, we do incorporate quality assurance in our process. So a little bit about the subjects. So the demographic characteristics, this would be your stateside questionnaire. Then we get into the social characteristics. And this is all leveraged from the American Community Survey. One reason why we do that is so that our processes can be more efficient when we collect the data. So we're piggybacking off of Census Bureau operations and processes already in place. So we're able to release the data faster than if we did not. Social characteristics, disability, fertility, migration, marital status, all very important. Economic characteristics, commuting, health insurance, income, and then housing characteristics, acreage, agriculture, computer usage, sewage disposal. All of this you'll find in the American Community Survey. There are 4 questions that are different between the island area censuses and the American Community Survey. And that has to do with like home heating, right? You're in an island, so you don't have to heat with a furnace, stuff like that. We call it common sense questionnaire changes. And here we go with, so every 10 years, this is one problem, and my colleagues had mentioned it, is everybody was used to the 2010 numbers, 375,000. And if you look at the biggest change, 19,000 for the Virgin Islands, it was an 18% drop in population. This was a surprise to everybody. The population drop wasn't a surprise. Everybody thought, there was going to be a population decrease. But going under 100,000 for the Virgin Islands that's a big factor because they get less data products from the Census Bureau. So everybody was hoping for 100,000 and ended up with 87,146. Now the governor sees that and he thinks, oh, well, the data must be wrong. I mean, it's, that can't be right because they've had no other indicators over the last 10 years that there's going to be this big of change. So that's a problem that we need to help with. The Virgin Islands did have massive changes over the last decade. They had a refinery close in 2012 in St. Croix. They had 2 Category 5 hurricanes in 2017, Hurricane Irma and Maria, which decimated the islands and other Caribbean islands. So I saw this number when I was in the field, and that made me nervous. And so we made sure that number was good. Census Bureau stands behind our numbers. We feel good about that. But if I was a governor, if I lived on island and I see this and I see the percent drop, I would wonder what we were doing and why there's no indicators before the 10 years for that. So What's next steps for us? Like I said, I was the census advisor in 2020. So there is a passionate army of island area people at Census. Dom and I are carrying that torch for 2030. We have lofty plans. We'll see how that goes. We're still in the research phase, but I will share some of our research. The first thing we were interested in is improving content. So we reached out to all of the islands, and was one of our research plans was to is the content good for the island areas? So we're wrapping that up. The other is modernization. So we're using paper questionnaire and we're going in person. It's very expensive. It's the best quality data, but it's also very expensive. We're looking at, can we do it on a device? And shipping those to the islands. So more to come on that. And then implement and maintain a island area master address file. Lots of islands, Virgin Islands are working on the address. Guam has a address standardization they're working on. CNMI and I think American Samoa will follow behind a little bit on that. And the last thing is to use administrative records, sources and usage in the decennial census. So we're being more efficient with our operations. At the end of this year, we're leaving the research phase and we're going to start testing this. We recently announced the 2026 census test. So we're hoping to get some of this in plans for that. In 2026, we're going to begin our 2030 requirements on our contracts. In 2027, we'll start the hiring of our census advisors. We'll train them up. That takes about 2 years, and then we ship them off on island to be there for a year. Unless there's a pandemic, we might ask them to stay a little longer. 2028, we execute the contracts with the governments, and then 2029, we open our census offices in the 5 areas. So I know 2030 is 6 years away, but we already feel the stress, and we have to go back to Suitland soon and start working on 2030. But it was great to be here today to talk about island areas. I will say that I think now there's been more synergy around this conversation. There are more people speaking loudly about it. And I am, for the first time, hopeful that change is going to come in good change. So I hope everybody here in this room is walking that walk with me. So thank you for having us today, and look forward to any questions.
I want to thank all of you, not only for what you do, for the ways you have implanted those feelings in all of us. All of you brought something that I will never forget. So we are ready for questions. We would like to present more an opportunity for anyone to expand on the discussion of GAO report. And let's start with that and then hear all of your questions.
I have thoughts on the GAO report. I can kick us off. So for folks, I know it was brought up a little bit, but the GAO was tasked by Congress to look into data gaps affecting the territories across all federal statistical agencies. So not just Census, not just HHS, but all the labor, energy, like all the agencies. The report just came out a couple weeks ago. It's available on the GAO website. But it identified, I don't think the findings were probably a surprise. There are significant data gaps affecting the territories. And the recommendation, and I wrote it down verbatim, thinking this might come up. The recommendation is that OMB ensure the chief statistician develop coordinated government-wide approaches for federal statistical agencies to use in consultation with territories and other stakeholders to examine the costs, benefits, and feasibility of including territories in statistical products, and as appropriate, identify ways to address these gaps. So I think where that leaves all of us is sort of saying, hey, we're interested in looking to address these data gaps. Now there is sort of mandate's a strong word, but there's a GAO report calling for federal agencies to organize to address this issue. And we all have experience on how to do that and sort of existing touch points that could help do that. So I think for me, I saw this GAO report and I said, great, like, let me talk to all the HHS agencies that are touching data and say, hey, we have this way that we've worked with the islands for Burfus and for these 6 data sets. Like, we have a method where you can have islands lead this conversation. There's motivation, and I'm excited too about the possibility for good change. So I'll open it up to you three, but those are my notes.
Thanks so much. Any questions for involved?
Not so much a question, but so I'm Adam Carbolito. I'm Director of Policy and Advocacy with the Association of Asian Pacific Community Health Organizations, or APCHO. We're a national nonprofit association that represents community health providers, organizations in all 50 states, U.S. territories, including the freely associated states. In my former life, I was Chief of Staff to Madeline Berdallo, who is the former Guam delegate to the House of Representatives. So I just want to say, one, thank you for all the work that you're doing in order to improve the understanding of how data sets are collected and reported in the U.S. territories, the gaps. We know that it is a significant challenge. I would love to, just hear your thoughts. I know there's the GAO report that came out, but, talk a little bit more on how we as individuals who work in various industries and sectors can support the work in order to ensure that the territories are included in federal data sets where it is most appropriate. I know when I was on the Hill, it was a huge challenge. Not being incorporated into the ACS was a huge challenge for our office in trying to understand how our demographics had changed between the decennial census, or how we included into other national health models, where oftentimes the territories are not represented, or we're just an asterisk that says we are statistically insignificant. And when we're here in a health equity conference talking, the inability or the unavailability of information is really a health equity issue. And it really makes it so, as the title of this session says, we are invisible, and we are just not considered part of the American family. So I would love to hear more on how is it that we can partner with your organizations, with your agencies, to ensure that on the federal agency side, we are incentivizing the agencies to collect and report this data. And on the advocacy side, how is it that we can push our policymakers to ensure that this is actually done, especially leading up to the decennial census, but all the years in between?
Thank you.
So I'll talk a little bit about some of the challenges with survey work, because I think we have to talk about the elephant in the room, and there are a lot of challenges with survey work on the islands. Population size is one, where the population's so small that you can't release data without identifying somebody unless you inject so much noise that the data may not be worth anything. It's expensive. I mean, everybody wants to collect data in the island areas, but it is very expensive to do that. And so we need not only the authority, but we need more budget. In the short term, in my opinion, I think because surveys are so hard in the islands, I would push for a 5-year census for the island areas. And I think that would have a better chance in the short term to get more traction, and then worry about a long-term plan of somehow getting more surveys or more federal data points in there. But short term, I think a 5-year census would be the way to push. And the GAO report, I saw it before it was released and provided some information for it. And I think that this session today is more powerful than the GAO report. And I think that if we're all talking about the issues and then we all scatter out and we do our part, then that's going to be better than any report that not many people will use.
I would just say I agree with what you're saying. And so Dr. Maybank earlier was talking about narratives and shaping narratives. And I think that's part of what we're doing today. And having us all kind of know what the boundaries are is important, because people say, oh, the data isn't there, but then the why, I think we all have to be on the same page for. Is it the funding? Is it congressional mandate? Is it technical skill set? And then we know all together, this is the landscape and that conversation. So then the census can go back and do their work, and Burfus folks can work with ASTO and do their work. And we're kind of illuminating kind of the boundaries. So that's why I think just keep this conversation going.
I think one thing that in the GAO report that I found quite interesting is please correct me if I got this wrong, is that I think certain agencies weren't aware that they could include the territories. So I think that's something we found in some of our research too. There's nothing in law and statute saying that the territories need to be excluded. It's just, I think, actually in the case of Title 13, as kind of your slide was showing, it says that most of the territories could be included, and I think was it American Samoa could be included on the determination of the Secretary of Commerce. And this for me kind of gets to a larger point, is that I think part of why this exclusion happens is because there isn't a statutory requirement for data in places and some of the territories. So for example, I mean, I think if there was political redistricting happening in, that's a very different bull, I guess, where there was political representation and empowerment in the US territories. I think that the lack of statistical data, I think, goes in hand with political disempowerment. And I think that needs to be looked at. And as we look to the future of things like how administrative data are being increasingly used and integrated in statistical surveys with fiscal pressures and declining self-response rates and things like that, is what administrative data, I know I think the Census Bureau is looking into it, but also the absence of a lot of government programs and supports in the territories means there's also fewer sources of good quality administrative data. And so I think as we look forward, there are larger issues, I think, that the disparities in our statistical system are a reflection of and a sign of, that there's sort of deeper things that also need to be solved that would actually help, I think, alleviate, would actually drive use cases for statistical data to the territories. But that's, I think, yeah.
My last piece then would be, I agree, being the squeaky wheel, whatever data sets you touch, whether it's financial, grants management, maternal, child health, anything, sort of, do they include the islands? How do they include the islands? When we went to the National Vital Statistics System and said, hey, why aren't the freely associated states in your data sets? The leader just said, we've honestly never been asked that question. Like it is out of sight, out of mind. And I think bringing the islands into the family photo, as you put it, I think is a really good way to think about it. And I think taking no action will extend the inequities. And I think doing anything is a good place to start. And I'll just put in one thing that ASTO works on when it comes to data is sort of, there are a lot of ways to build data capacity, no matter what work you're doing. And I think it has crossover effects. So whatever part of public health you touch, helping the islands build the capacity to collect data, to analyze it, to report it, to use that data for decision making, I think that's sort of the long-term goal.
Oh, we do have a question from the virtual audience. Timothy Cronin is asking, are there any plans to collect data on climate and health impacts of individuals in the territories?
I can, a partial answer. Yes, there are plans, and yes, there have been identified gaps. I think some of the best indicators for social vulnerability as relates to climate change, the data sets just say no data available for the territories. And rather than having that count as, oh, significant health disparities, significant challenges, they just sort of get cut out from the rest of the analysis. So I think a step in that regard could be making sure that if island data isn't available, taking that as a sign of a disparity rather than just sort of getting cut from the equation moving forward.
Yeah. And I would just, if this person isn't familiar, the National Climate Assessment, I'm like looking at you like you asked the question. The National Climate Assessment has a chapter on the Caribbean, it has a chapter on the Pacific. So I know like NOAA and FEMA aren't on this panel, but I think it's a good question to broaden the conversation. But I don't know, Jejun, you were saying you're working on some of these topics, or?
Yeah, no, it's something I've personally been thinking about, but I'm not sure that there's any planned data collection at least. Yeah.
Any other questions in the room?
I know we are tight on time, but not necessarily a question, just an observation. And thank you that even though I caught, the majority of that was late. I come from a quality improvement organization that supports hospitals. And we had the privilege this time, I think that's loud enough. We have the privilege this time around to partner with a hospital in American Samoa. And it was just very eye-opening because the majority of our work had been in a continental U.S. here with the different challenges that Colorado hospitals face or Oklahoma hospitals face, but the unique challenges that American Samoa in terms of cultural differences as well. That was eye-opening, because the initial blanket statement on, okay, we're going to help you with your challenges for your hospitals, for quality improvement, your projects and all of that, were quickly, have to be rethought, because they have a different way of thinking. Not necessarily a bad way, but it's just something that we need to consider. For me, it was eye-opening, seeing some of that data. And I think that in terms of data, I know that data drives a lot of things. I know that we are talking about narrative driving a lot of the rest of the journey. I think it is important for us to, even though we don't have the massive amounts of data, whatever we can put in front of organizations like quality improvement organizations, federal agencies, nonprofits, is valuable. Even if it doesn't make that impact of the statistical analysis that we would want, right? In the thousands and the millions. That's something that we have identified, working with, a small community. So I just want to, echo the efforts, but if there is a way to partner with the data collection initiatives, taking into consideration the cultural differences, taking into consideration their own challenges, and then align that with the call to action for addressing disparities, I think that the census will no longer be just one more tool for data collection. It will actually be a way for community centers, a way for hospitals, a way for governments to say, okay, there is more work to be done, because information that has been captured there can also help with those changes in policy that perhaps, are only right now taken into account for the continental U.S. So thank you, Carol. I don't know if we have time. Maybe we do have time in Alaska. So it's well, maybe not. All right. Okay. Okay.
Yeah. Yes, understanding. Thank you all for being here. I recognize this might not be the most appropriate audience to ask this question, but I will do my best and you can do your best to answer it. I'm curious, being that we're at the CMS Health Equity Conference, if you can talk a little bit about the inclusion or lack thereof of the territories and islands in CMS data in particular, and how they are or not included in various reports that we put out.
Yeah, so we've been looking at that, and I'm looking at Teresa and Christine because they've been helping us with that very question. So over the past year, we did look at not just like ACS and Census or all of the CDC data sets, SAMHSA data sets, but CMS data sets as well. And largely, territories were represented in most of our data sets that come to CMS, Medicare kind of things. The bigger challenge that we noted was when we design programs or policies that pull from other data sets, like the ACS, then the gap becomes part of the challenge to solve. So, yeah, I think we have a lot of work still to do in figuring that out. But what we've been trying to do is document it for the agency and then also raise awareness with the different centers and offices and talk to them through the OMH data leads and really leverage that relationship as well. So it's an ongoing conversation, but I don't know, Darcy or Marina, anything, Christine, Teresa, anything to add? I think
I probably need the microphone.
okay.
Not 100% speaking for, I see people nodding at me. Mm-hmm. Okay. Things I think important to note, when we look at the 5 U.S. territories, they noted 3.6 million individuals residing there. There are 2.3 million Medicare and Medicaid enrollees in those 5 territories. So when you think about the percentage of CMS, those that we are serving in those territories, that's where things become truly amplified. Medicare data is pretty solid, and that's that's easier for us to get from a data perspective, which is why you see so many Medicare data things that come out there. Medicaid, there are 54 different Medicaid programs. Medicaid data comes with a lot of benefits and some challenges, and the people who are way smarter than me on all things data are working on those things. We don't have the marketplace in the territory, so that is not part of that equation. And then when we're looking at Medicare Advantage programs, that's a kind of a different relationship, and that's a different relationship. So to Thomas's point, we're at the, because people don't know what they don't know. So we're trying to raise the awareness. We're trying to reduce that invisibility, saying, get it if you're not there yet. But can we just add the asterisk or the footnote that says, we acknowledge that the U.S. territories are not yet in this data set. And here's why. This requires so many number of people. This requires, whatever the reason is, just name it, because that reduces the invisibility. And then we can come up with the amazing solutions that our panelists highlighted today to try to amend that. But at a minimum, in the short term, we can start thinking about how do we remember the 2.3 million individuals that CMS is serving, who reside in the 5 territories that we mentioned. We don't provide services to the freely associated states, which is why we talk about the U.S. territories in a slightly different way, but that's also part of the fun of the federal government. We all talk about the same things in 17 different ways, which is, one of the reasons why we like to come to these conferences and connect all of the dots, because if we are not connecting the dots, we know that it's harder for those out in the real world, quote unquote, to connect the dots. But I know we are over time. Not going to speak for the panelists, but given the nerds amongst us, if you wanted to talk about things with them, I think they'd probably stick around. So hopefully that was helpful-ish.
What enough to end with.